Health and wellbeing equity acknowledges the differences in health outcomes for some people in Aotearoa, and it aims to reduce those disparities by providing specific bespoke resources and support that are community-led and defined.
Equity is about reaching the same health and wellbeing outcomes regardless of the input you put in, or regardless of your circumstance, regardless of your ability, whether it be around education, literacy, income. It doesn't matter.
So with equality, a response would be to give everyone sneakers. So in order for them to achieve their race, everyone got put into sneakers. But if you're using an equity lens, you'd be giving people the footwear that best suits them. So some people may have sneakers, some people may have boots, some people may have ballet shoes. So it's defining what the best resource is to ensure the best outcome for everybody. What we know is our people feel really comfortable within health environments where they see people who look like them, where they see people who can engage in their reo or their language, and people that understand what's important to them from their cultural context, knowing that karakia may be important as part of a process when they're having hui with medical professionals, knowing that they may be interested in broader treatment options that are more holistic, that embrace te rongoa Māori, or other components of that. It's just having an understanding of who people are in their cultural context and cultural ways of being.
It's not just the academic knowledge, but it's the social skills. How do you make them feel? Because if you have the academic knowledge, you know the information, but you can't portray it in a way that that person understands and sees it, then what is it all about? Cultural competence would look happy, it will feel happy, it would be bright and colourful. You know, when you're thinking Pacific, you like the floral bright colours in there, but it should feel a happy place, and you feel included and you feel warm.
Some of the societal influences that lead to inequities for health and wellbeing for people in Aotearoa relate to social hierarchies and specific environmental factors. So some of those things relate to intergenerational impacts of poverty, issues with housing and other things like that that continue to perpetuate health and wellbeing inequity.
Our Mass Foundation provide grants to groups, to communities who are aiming and journeying to achieve health and wellbeing equity.
We were really intentional about how we identified the community groups that we supported. We wanted to ensure that the hard mahi was recognised by those who are actually doing it. So we've embraced the kupuringa ropa, or the one with calloused hands, recognising that the mahi is done by our communities, and we are there to provide support in the background, whether that be via pūtea funding or non-financial support.
And we do it in a way that is genuine, authentic, and it is about people. At the end of it, it is about people.